So we have Dr. Sharmatha Kumar, who's a senior consultant in cosmetic dermatology. So she's been practicing for over 14 years now, and she also runs the aesthetic unit in SRM Sims Hospital, Vadapalli. So let's dive in. And yes, doctor. So can you tell me about how your interest peaked into choosing this particular
Dermatology.
dermatology after MBBS?
Yeah. So basically, what happens is you either choose to become a surgeon or a physician. And I knew that I wanted to become a physician, and I had a few options in my hand. I think one of that was to be to do internal medicine, and the other was to become a dermatologist. I never did want to deal with pediatrics or children. We thought of dermatology was because actually the skin is an organ that reflects what's happening inside. You really don't have to send the patient for a scan, or you don't have to do any procedures or any surgeries to actually identify, diagnose, or treat the patient. It's a very interesting topic because all you do is see the patient, see the skin, and try to come to a diagnosis. In fact, my teacher used to say that if you're a dermatologist, you're a detective. You just have to take a look in detail, and then you can actually come to a diagnosis. So that's what made it quite interesting, because all you do is you have a simple palette on which you actually create a diagnosis and then treat.
So how do you start your career, and you can explain a bit about the journey for
Yeah, so actually initially when we started, many people think dermatology is very simple, and you don't have to attend calls, you don't have to operate, you don't have to actually follow up the patient very closely. But studying dermatology was quite hard because you have to understand, like I said, you have to understand what is inside and then evaluate what is outside in order to come to a diagnosis. So it's not really, it wasn't easy to study. Also because we don't learn much dermatology as an MBBS student. As an MBBS student, you learn a lot of gynecology, general surgery, general medicine, or diabetology, cardiology, but you don't learn much dermatology. So it was definitely hard in the beginning, and we had tough professors as always. But then as time went along, we kind of molded ourselves into becoming a dermatologist. If you see, over the last 10 years or so, cosmetic dermatology has created a niche. So definitely cosmetic dermatology cannot exist without general dermatology. Unless you know what the problem is underlying, you cannot treat what is happening on top of the skin. May it be just acne or hair loss, you have to understand before actually treating a patient. So that's how we kind of fine-tuned ourselves into becoming aesthetic dermatologists.
so can you tell a bit more about cosmetic dermatology? What all is there under cosmetic dermatology?
Yeah, so the thing with cosmetic dermatology is where oral medications and tablets play a lesser role in comparison to what is given externally. So that's a simple way of classifying general dermatology and external cosmetic dermatology. Also, when you're dealing with a patient, it's invariably general dermatology. But when you're dealing with a person who has no skin issues but just wants to augment their appearance, we call it aesthetic or cosmetic dermatology. So in the presence of a disease, we're treating them, and that comes under systemic or general dermatology, where we have to treat them more with internal medications. But cosmetic is just augmenting normal skin or augmenting appearances, reversing aging, and things like that.
From the time you started practicing to now, how much do you think we've evolved in terms of aesthetic dermatology? Because I see people changing their face completely. Like
Completely,
whatever
yeah.
actors we see, like Tom Cruise doesn't age at all. You don't know
Yeah.
what's happening behind the screen.
Actually, there are two things. Yeah, you don't know what's happening behind the screen because half of it is also makeup. When you come to see media people, half of it is makeup, and they actually look different behind the screen. But definitely awareness has increased, and the kind of people who want anti-aging treatment is actually starting off in the third decade itself. So people's awareness is much more. They seek out for medical treatment, cosmetic treatment at a very much younger age. So that's probably because of awareness through social media, through the television itself. Yeah.
And so I would also like to know how much the environment plays a role in cosmetic dermatology or people's skin. Like, for example, I'm in Chennai. So I live in a particular climate, particular humidity, particular environment, and pollution and all of this. how much of it affects my skin naturally, like in everyday life?
Definitely, it makes a huge difference. Everything makes a huge difference. So, your genetic makeup is very different. As an Indian, as a South Indian, your skin tone itself is different from someone who's born elsewhere. And your skin adapts accordingly, like how much of sun exposure you have, how much of pollution you're exposed to, and even your everyday life, the rate in which you age also matters. How dry or moisturized your skin is, it matters. And even the same person, different body parts have different quality of skin. Like I'm sure for anybody, their face skin is very different from the skin on their abdomen. There are multiple factors because you don't expose your abdomen to pollution or sunlight as much. So definitely the environment plays a huge role, and everybody is evolving. If you see 20 years ago, though we're in the same city, the fact that we never used to sit in an air conditioned room mattered both. So now people have more dry skin. People don't hydrate themselves because they're in an air conditioned room. So environment plays a huge role, especially climatic changes also, like in which part of the globe you are in, extremes of weather, extremes of hydration, temperature, pollution, everything makes a difference, and how you respond is also something that evolves.
I see the word skincare being used a lot in the recent decade, last decade probably. Everybody uses the word skincare. Probably before that, in the previous generations, nothing much was actually, it was non-existent to be very honest, like 2-3 decades back. But now, like it's a routine. It's like everybody follows that. Is so. Can you explain what is actually skincare?
See, the skin responds to the environment, like what I said, and the skin changes with time, with aging and things like that. And with today's awareness, social media's pressure on looking perfect is something that has actually grown the specialty to the better to or for the worse. It doesn't matter, because what really happens is people want to look better. They want to do something to look better, and that's when they want to take care of their skin, and that's now becomes skincare. So it's just protecting your skin, keeping it healthy, and using different techniques to actually delay aging and to prevent external factors that causes skin damage. So that is where we stand now. People are being very proactive in preventing, or rather safeguarding, their appearance. So yeah, that's what skincare now actually.
So, is there a regular skincare routine for everybody? Like, these are the basics you have to do if you're in Chennai, like if you're in such an environment. These are some basic stuff you have to do to help yourself safeguard your skin from pollution or climate, heat, all of that.
See, there are certain things that are standard, and I think first and foremost, like I said, what is inside is what shows up outside. So you have to have a healthy dietary habit, you have to have a healthy lifestyle, and most importantly, you have to hydrate yourself, because the skin has plenty of water. There is a layer of skin that's like called the dermis, and it is just water, it's just suppleness. If you see a child has plump skin, but when an elderly person's skin is there, it's literally lax like a piece of cloth. So that's because of that layer called the dermis, and that's why it's very important to hydrate. And that doesn't happen now because we're sitting in an AC environment. We don't feel thirsty, we don't hydrate ourselves, and we tend to age faster. We tend to get many more skin conditions. So the basic things is diet, hydration, exercise, keeping your pores open, sweating sufficiently, keeping your skin clean, dry, etc., etc. But then comes the question of skincare and what they have to do to prevent it from becoming worse because of Chennai's humidity, or because of Chennai's pollution, or because they travel outdoors on the bike and things like that. So in that, I would say choosing a right face wash is very important. Choosing a right moisturizer is very important, and choosing a right sunscreen. But beyond this, we'll all change our treatment as to what the patient needs or what the person needs.
So, products and their choosing the product actually runs majorly on advertising and marketing. Where you see what, you just go try it out. So, are there any specific set of products, like people say aloe vera is really good for health? We actually don't know what is inside that particular product. It's
Correct,
marketed
correct.
like that.
Correct.
So, would you say these are the elements which needs to be in your products for skincare?
This is where cosmetology comes into existence. See, there are multiple chemicals and compositions which are even in fact discussed on social media as actives. They call it actives, and these are particular ingredients or composition that actually works actively on how the skin is formed and how the skin is responding. So it's very important to know what the person needs. Like if a person wants to address their tan, they require a different active. If a person wants to address any acne or skin infection on the face, they have to use the right product. And if they want to address aging and they want to undergo some anti-aging treatment, we'll give them something else. Like for example, if you want to address the tan, you have to give something that contains glycolic acid or azelaic acid and depigmenting agents. But if you want to address, say, something like anti-aging, retinol is the first option. Combining a retinol with salicylic acid is very useful for a person with oily skin and pimples. So that's why it's like you have to understand what every ingredient is, what every composition is, and then use the right one. The steps may be similar, but the ingredients or the actives changes from person to person and what they want also.
So, when it comes to beauty, there are two things. One is the plastic surgery, which people go through to change their facial features, like the nose and the lips, all of that. And it is closely associated with their skin as well, how they glow. So, Korea is a place which is so very famous for South Korea. Everybody wants to travel there. They save up for going there
True.
and changing themselves before coming. Does it actually work in the long run? Does it work for any ethnicity or any?
No. See, actually, Korea and Thailand, Bangkok are like the hubs for plastic surgery and also the hubs for cosmetic treatment and cosmetology products these days. So, the reason why it happens is the skin is very malleable in them. And when you look at our skin or even the African skin type, the skin is very thick in comparison. We have much more pigment, we have a much thicker hair follicle, much thicker oil glands. We sweat much more in comparison to them. So there are multiple factors in just the quality of skin that we have and they have. And how it responds to a plastic surgery is very different. Like their skin barely scars. If you have the same trauma, if the person has the same surgical incision, in India, we're likely to get a mark, we're likely to get a scar. But if you do a surgical incision on Caucasian or Mongoloid skin, the scars are very much lesser. So that's why it's been easy for them to achieve what they have achieved in terms of cosmetology, in terms of plastic surgery. But it's very difficult to achieve that, or almost close to impossible to achieve that in Indian skin.
But the same procedure is done for us also.
Simple. We have under eye bags for which we seek out and do a procedure called blepharoplasty with plastic surgeons. Now the Koreans especially, have puffy eyelids, that is the upper lid, and that's what gives them the Caucasian eye. They go ahead and remove a similar fat pad from the top of the lid, and the women look like dolls. They just remove that extra fat pad, they get larger visible eyeballs, which gives them that innocent and doll-like appearance. The same thing cannot be done on an Indian eye because the Indian eye is shaped differently. And even if you want to remove the lower lid for, say, under eye bags, the procedure, surgical procedure is very much the same. The skill of our Indian surgeons is very much the same, but the result is totally different. You understand what I'm saying? So everything right from our bony structure to the shape of our nose to the bony structure of our jaws and the cheeks, everything is different. So treatment is very different.
There are two things. One, I was personally diagnosed with eczema last year. So I was given a specific moisturizer to repair my skin whenever there's a flare up. I use it probably once or twice or thrice in a year. When it flares up, I use it for a span of probably 2-3 weeks. And then I don't use it and it's normal. And suddenly when it flares up, I get to know that and an itching starts and I used to use that. So that is kind of a treatment when it comes to dermatology.
Correct.
So
correct.
how different is cosmetic dermatology? Because every day people
Use a
their skincare before
moisturizer,
going to bed,
correct.
or every day they use a
Correct,
moisturizer or a
correct.
sunscreen. There are
Correct.
so many myths about sunscreen and moisturizer. You don't use it. It
True,
might have
true.
carcinogens, cancer-causing agents. So how are we supposed to make sure
Know
we
it,
choose the right
yeah.
product
Yeah.
or know it?
See, actually, it's a huge gamut. Like when you say moisturizer, there are huge gamut of products that actually are moisturizer. And like I said, no, there's something called an active which is being used in every ingredient. So, like just to answer your question, that there is inherent properties of the skin that contain moisture. Like I said, the layer of the dermis contains moisture, but it contains hyaluronic acid, it contains ceramides that are all inherent and integral part of everybody's skin. You have less of that, you have dry skin. You have to hydrate it, and that's what everybody does over the counter. But say for a person who has an eczema or a psoriasis, they also have dry skin, but the dryness is so severe that even a moisturizer with ceramides or hyaluronic acid would not suffice. It wouldn't even penetrate or hydrate or clear that problem. There's sufficient inflammation to address. So you got to give them something like urea, something that contains lactic acid or urea. So that's where a dermatologist plays a role. You know, you can't just take anything off the shelf and use it. You can't use a moisturizer that is used on the feet for the face. That's going to burn, that's going to sting your skin. So definitely it's very important to understand, even if it is just something as simple as a moisturizer, and to use it appropriately.
So, as a common person, I see a lot of Instagram reels, for example, and there is a lot of skincare routines, procedures. People get paid for being an influencer for specific brands. They keep promoting that. So, even if I don't have an issue, I'm going to start a skincare just to glow for a specific thing. Is it necessary to actually get in touch with a dermatologist in that specific domain before using normal products? What would you recommend?
Like you're asking if it's mandatory to go to a
Is it better
dermatologist.
to go
It's
to such?
definitely better to go to a dermatologist, especially if you want something, you know. Just because you want something, you just don't take it off the rack, especially if you have some sensitive skin, or your lifestyle is such that you're always in sunlight, or your lifestyle is that you're wearing a helmet and you know, you're losing hair. So it's very important to get the appropriate guidelines, especially follow the guidelines with the help of a dermatologist, because you know that you're not going wrong. It's very easy to go wrong.
Is hair care also a part of cosmetic dermatology?
Yes.
Okay. So hair transplant,
Yeah.
everything comes
So
under the.
dermatology is basically a specialty that addresses the skin, the hair, and the nails. So everything on the surface of the body. So it all three come under a single organ, which is the skin, hair, and the nail. It's just that it manifests differently on the patient or on the person.
So one more thing is, I don't know whether this is real, but I did find a data that lot of people, men especially, are losing hair at a very young age. Very rapidly they're losing.
True.
And you can find people who are bald at 30, 25 and all. Is there a specific reason for this trend?
Yeah. There are multiple reasons actually. And like what we say, we always blame the diet and the lifestyle. It's true. For example, people are fatter these days, people are taller these days. That's because of their diet. People lose hair also. That's because of their diet. And see, everybody loses hair ever since adolescence, and everybody grows. The hair grows back for all of them. It's just that the rate of hair loss and the rate of growth should always be in balance. When it becomes imbalanced is when you start balding. And why it becomes imbalanced is because you're not able to provide sufficient nutrition, and there's not enough a healthy environment for the hair root to grow. So that's how balding starts at a very younger age these days.
What are all the procedural options we have for hair growth, or once person loses hair? So after that, if he wants to, say, they plant hair, transplant future hair. So what are the solutions available for a person probably at 30?
Yeah. So, like I said, we'll go back to being a dermatologist. You have to diagnose that this is just balding or this is just thinning, and the patient doesn't have some underlying disorder. Say, for example, post COVID, many people lost hair. They had a lot of hair loss after COVID, but most of them, it grew back once they recuperated themselves. So, you have to diagnose why they're losing hair. And if you're certain that it's just thinning or if it's just balding as a process of aging, you can give them external factors, like there's something called minoxidil, there are oral hormonal tablets, like it's called finasteride, and then now there's finasteride that's given externally, there's minoxidil that's given internally. So we actually diagnose the patient and then treat it as to what the patient needs. And if the patient doesn't respond to these liquids and to these solutions and of course to the tablets, then we go in for procedures. And initially, even the procedures that we choose are like minimally invasive. So we give them PRP injections or GFC injections, which is nothing but taking the growth factors from their body and injecting it to target exclusively the hair roots, so facilitating hair growth. So that's one way. or if the patient literally has no hair to grow and literally the growth factors are not going to be fruitful, then we jump into hair transplantation. And there are multiple techniques of hair transplantation also.
I also found the fact that Turkey is very, very famous for hair.
Yeah, yeah,
Everybody
yeah.
around the globe goes
Yeah,
there.
yeah,
Anything
yeah, for
specific
sure.
about Turkey, like Korea for skin and
Yeah,
surgery?
yeah.
Like,
Turkey is for hair loss as well as rhinoplasty. Middle East and Turkey is also for rhinoplasty. They already have great features, but still they're the most famous for rhinoplasty and for hair. It's probably because they've come up with newer techniques, that's all. They're the first ones to actually bring in robotic hair transplantation, where you can transplant thousands of hair in much lesser time. But when you're doing it manually, you're going to take 6 hours or 8 hours to do one hair transplant.
and the recovery period for that and all.
Yeah, it's a huge time, because initially you are undergoing a procedure. For you to recover the acute stage where there's going to be swelling and all that itself is going to be 5 days or so. And then for you to wait for your hair to grow, it's going to be 3 or 4 months. So initially the patient will have to take treatment for those first 5 days, anti-inflammatories, antibiotics to make sure that nothing has gone wrong during surgery. And then for recovery and for the hair to reach its normal length, 3 to 4 months.
So when it comes to the details of that, how is it a living hair part which is
Yeah,
planted and again it
correct,
grows back to normal?
correct.
So it is like reaching normalcy after planting.
Yeah. So just for example, if you see a totally bald man, like you can imagine a totally bald man, he'll retain hair here no matter what. They'll go bald completely, and this area is an area that cannot be touched by the normal process of balding. So we capitalize on that. We choose those hair follicles, we pull it out and we place it in areas where they need hair. And invariably, the choice is made in such a manner that you frame the face. They lose the hair, they're going to look older. You frame the face with a good hairline, they're going to look younger. So we target hair that is actually not going to fall. The classical example is the hair that is there at the back of the head, and sometimes we choose beard hair also because it's very good quality hair.
Oh, okay. Got it. Now coming to the diet part. So what are the foods you would actually say
For the
will help the
skin,
skin? Yeah.
yeah. So definitely I just talked about hydration, because the skin has multiple layers and the dermis is the layer that is full of water. So you have to hydrate the skin both internally and externally, because nowadays we are exposed to a very dry climatic condition inside AC rooms and all. So it's very important to hydrate the skin from externally as well as internally. Apart from that, fruits, obviously, we know the importance of antioxidants, because the first and the foremost problem with something that causes skin damage. So, like I mentioned, water is one of the most important ingredients for the skin. There is a layer called the dermis that is full of water, and it's important to replenish that water from within as well as from outside. So you use the appropriate moisturizer to hydrate the skin as well as drink enough water to hydrate the skin. So it's a delicate balance. But apart from water, diet is also very important, and we're all aware of the fact that fruits are very rich in antioxidants. Now, why the skin gets damaged is because of something that's known as oxidative stress. So this oxidative stress is from multiple factors. It could be pollution, it could be sunlight, maximum sunlight, and it could also be things like poor diet and smokers. Smokers tend to have very much of a damaged skin. People who consume alcohol, people who have diabetes also for that matter, diabetic patients and all. So it's very important to reduce that oxidative stress, and the only one that does that are food that's rich in antioxidants. So that's why we call it as an antioxidant, to reduce the oxidative stress. And fruits is the richest, berries for that matter. And in Chennai we don't get berries as much, or it's very expensive. So citrus fruits is the other option. Guava, apple, apart from the regular citrus fruits like oranges, lemon, and amla, and all those things.
Yeah, and common skin problem you face like day in day out, people coming in like a regular skin issue. It's very rampant. So that kind of a skin issue. What
Is acne, for sure. There are two things which I see the most common is acne and dandruff. Almost everybody says I have dandruff, and that's because they don't take care of their scalp. And acne because it's something that shows up on the skin because of multiple factors. For some children, it's just bad diet. For some children, it's their adolescence and their hormones are working. But when it comes to an adult, it could be diabetes that manifests as acne. It could be something known as polycystic ovaries in women that manifests as acne. So because there are multiple factors that show up as acne, I see quite a few of acne in the OPD. But apart from that, dandruff is one thing that I also see plenty.
So, can you tell about one or two interesting cases?
Actually, I'd like to say one more thing. In the OP, we actually see a lot of patients who want fairness treatment. So they either come in saying, I have patchy pigmentation, my skin is not even, I want to get that glow, I want to become fairer, I want to get brighter. So that's another thing that is more so in South India. South India, a little bit in North India, but more so in our Indian, yeah. We're darker skin and we're looked upon, with more respect when you have fair skin. It's a subconscious thing that people have evolved over, I think, millennia. But yes, it's something that I see every day also.
So, is it actually doable, like looking more fair over a period of time? Like,
See, there are
do you
drugs.
recommend?
Pragmatically speaking, there are people in the media who need to look a certain way, and for them, it's almost something that they have to deal with. So I do give them injections that it's called glutathione. It's an extremely rich, concentrated antioxidant that actually destroys the pigment cells. So yeah, they do take tablets or they do take injections. And there are some people who just want it on a regular basis. I give them a very low dosage so that they don't undergo any side effects because of it. But yes, pragmatically speaking, it depends on why the patient needs it, and that's why it's important to provide adequate treatment for the right person and not overdose on
And is
the
it
person.
irreversible? Like once you
It's
do it,
everything is reversible. See, the skin is an evolving tissue. Okay, it's just like the liver. The skin changes. Like every time you take bath, you're shedding skin cells, and new skin is coming. And if you want any skin treatment, you have to stick to it because it's something that's for good. The skin is an evolving organ. It's not something that you can just deal with once.
like people say you need to drink like 3 liters, 5 liters for a good glowing skin. Is it actually true?
It's just for healthy skin. I wouldn't say glowing skin. It also depends on your body weight, it depends on your environmental factors. But water is essential for healthy skin, not really, glowing skin. It's something that's mandatory, it's not cosmetic.
Any cultural or things which have been following for skincare over a period of time which you feel is a myth and unhealthy? Like any routine people follow?
Over the counter medication is bad enough, that is one thing. I've seen people use steroids because actually what happens with steroid creams is it brightens the skin by destroying certain cells that's called the melanocytes. So they get immediate brightness and patients get carried away. They start using steroids on the face thinking that they're getting brighter, but the minute they stop, it just damages the skin totally. It becomes thinner, they get rebound tan, and of course it's making them susceptible to environmental damage. So definitely I would say the most abused product are steroids. The second thing is, which I see in Chennai, is people, they say they're going in for organic treatment, they say they're going in for herbal treatment, and they use stuff that's actually not FDA approved, or rather that's not studied upon. I mean, I've seen people who have applied garlic on their face for pimples, they've applied toothpaste on their face for pimples. So yeah, we see all kinds of patients who go wrong with their treatment.
Something, uh, because you're a doctor and nobody else can tell better. Some global trends in skincare which will not work for us. You tell something like that.
Snail mucin. I don't know if you've heard of it. People let snails crawl on their face and they say that mucin from the snail is something that will penetrate the skin and bring about a glow. And there are a lot of Caucasian skinned Hollywood stars, and there are also mongoloid skin type people, even regular people who do that snail mucin thing. That's a global trend that really doesn't work on Indian skin.
Any tip you would like to tell to people who are starting skincare?
I think they should, if you want to start something just to augment your appearance, it's better to go in for a proper guided skincare routine. Like you reach out to a dermatologist itself. You don't have to go to a cosmetic dermatologist or an aesthetic dermatologist. Any dermatologist would know what is essential to prevent further damage and to take care of your skin. So the only thing I'd say is if you want to change anything and do something to your skin, whether it's to augment your skin or to just, look better, feel younger, you get it done the right way with the help of a dermatologist.
People who go to the gym every day, is there something we have to do specific to maintain their hair? Does gym or workout affect your hair?
See, one thing is definitely you're going to be sweating more when you go to the gym. So it's very important to maintain a clean and dry and healthy scalp, because one thing is if you're going to be sweating a lot, you're likely to harbor infections. And if you don't wash your hair frequently, that could be something as common as dandruff. You have to wash your scalp, keep it clean and dry to prevent infections like dandruff. So I would say the first thing you go to a gym, you should be prepared to wash your hair frequently. Use the right shampoo, because you cannot be using salicylic acid based shampoo on a daily basis also. So use a shampoo that's very mild, it's sulfate free, paraben free, less fragrances, not to use things like tea tree oil shampoo and ginger shampoo, which is all just a fad. So you use the right product frequently to keep your scalp clean and dry. And another thing is people who go to the gym, they tend to supplement themselves with either whey proteins or even other, high protein diet, which is not a natural source of protein. So there are a lot of studies and research that say that these proteins can actually worsen hair growth, which can actually reduce your rate of hair growth. So I would say if you really want to take care of your hair, try not to do those artificial supplements. Go in for a higher protein diet.
One more thing is, are there some things which we shouldn't take lightly when it happens to our skin? Are there some, because you
Some
said,
telltale
yeah,
signs
like you say skin reflects what is inside, right?
inside, yeah,
So
yeah.
when this happens, you have to go to a doctor
Immediately,
immediately. So is
yeah.
there something like that?
Yeah, definitely. See, there are a few things like telltale signs of malignancies or telltale signs of skin cancer. You should know how to identify it. If you have a mole, or if you get a mole later on in life which is suddenly increasing in size, or something that is flaking from the mole, or if the mole changes in color from being black to brown or black and brown, so you have to watch out. You have to go to a dermatologist. It's quite rare. Skin malignancies and melanomas are quite rare on Indian skin. But yes, if you do notice something that's growing in the form of a mole or a colored mole or something, you have to go to a dermatologist. Another thing is a lot of renal diseases, and that is kidney failure, and liver diseases manifest as itching. So if you have generalized itching with no rash and you just feel very itchy, it's always better to seek out for medical help, because it can be something as problematic as a liver failure or even kidney failure.
One thing we've not spoken about is the nail.
Yeah.
So I was always intrigued that people cut their nails so short their skin gets exposed.
Yeah, yeah,
Is there
that's
something we shouldn't do? Is there, and how significant are symptoms when it comes to nails? Like there are patterns forming in the
correct,
nail, there
correct.
are white color
So
marks.
the white marks are nothing much to worry. The white marks that happen in children and even in adults sometimes is nothing much to worry. It's attributed to nutritional issues. But if you get those lines, which are basically black lines that grow vertically, you have to seek out for medical help, because if that line breaches your cuticle, then you might have to get your nail removed. And another thing that we commonly see is people who wear ill-fitting shoes, no, they get either athlete's foot or they end up getting ingrown nail. So those are two things which also like is missed out in nail care. They wear ill-fitting shoes and they go for jogs, and then they get ingrown toenails, becomes painful, or they even get callosities. So that's something that we see commonly in nails.
Yeah. So thanks a lot for your time, doctor. And I think it was insightful. We've spoken a lot about
Yeah,
dermatology and things like that.
it was a pleasure.